To start with, actually, fertility itself is kind of a nightmare. I was just talking to some unmarried people here. They already feel fertility. If they have fertility problems, it can be difficult. So it can be, we can just imagine the plight of couple who already have fertility problems. I'm sure it must be a nightmare through them.
Sure. I feel infertility is like a hidden story, and a lot of times women don't want to disclose either to their parents or their family what they're actually going through. And when women face problems, it gets very difficult because they start placing themselves too low in their own eyes and in the place of their family. At the same time, when men have problems, I think they also go through equal emotional challenges, but unfortunately, men are not really attended to. So I feel it's a couple problem, and both husband and wife go through a lot of emotional challenges. It's a very, very turmoiling journey of emotions, and psychological aspect of dealing with fertility, I think, is the first and foremost thing that has to be addressed.
Yes, true, doctor. Actually, navigating through emotional journey, challenges is the biggest thing for now.
True.
Let's begin with Dr. Archana. So, what are the kind of face as a couple when they come over to you? Or how do you actually go through the treatment with such couple?
See, as soon as they see that they are infertile or they are not able to conceive, we don't say them infertile, but fertility is a problem with them. So when they come to a hospital, before itself they'll be worried about what may be the reason and whether it will be treatable or not treatable. First, as soon as they come from reception till my consultation room, everybody should be very friendly to them because they are already into kind of anxiety, and some people might have already gone through so many treatments that they would have come to us. So give a hope from there itself, and once they walk in into your chamber or your consultation room, you should just read their mind. Where are they? Are they into like open up with all the kind of treatment or whatever you're counseling, and where is their situation now? They have gone through, do they have any knowledge about fertility and what is required and all that? Based on that, you should always counsel them that whatever is the issue, we'll tackle. Initially, you should give them little hope and then start with their counseling and history taking. When you take, it's not just a history taking which is related to menstruation or fertility issues. It's about how pressurized they are about their fertility, how many years of infertility they are going through. So based on that, should always plan their fertility treatment, their investigations, and everything should start with counseling them about the normal physiology of menstruation, physiology of fertility, and then make their things clear. Like if whatever the fertility issues they have, we have a kind of treatment or we can help them at each stage. So that's how we start with counseling and the treatment after realizing their mental status.
Dr. Rashmi, yours is ಖುಷಿ fertility treatment.
Yeah.
ಸೊ ಈಗ ಎಮೋಷನಲ್ ಬ್ಯಾಗೇಜ್ ಇಟ್ಕೊಂಡು ಬರ್ತಾರೆ, ಖುಷಿಯಾಗಿ ಹೇಗೆ ಹೋಗ್ತಾರೆ ನಿಮ್ಮ ಫರ್ಟಿಲಿಟಿ ಸೆಂಟರ್?
See,
ಹೇಗೆ ಅಡ್ರೆಸ್ ಮಾಡ್ತಾರೆ?
what I feel is it's a journey from pain to happiness. And that's why I think it's all about that word khushi and happiness in their lives for which they strive. And I've heard some people telling me, I've interacted with men who have told, Doctor, I've achieved so much in my life, I've grown so much in my career, but then if I don't have a child, it's like my life is zero. When a man tells like that, it really hurts. And women, their tears are most of the times not attended to by family members, unfortunately, despite education being so high in certain families. And that is something that really pinches me. And the most important thing when it comes to fertility is that fertility treatment or the journey of fertility is that there has to be a lot of understanding between the lady and the man in her life. And the wrinkles around her eyes, the happiness that she shows, all these things are related to the kind of man she has in her life. In case she doesn't get that kind of support from her husband, then she starts feeling very lonely, and that's the most difficult journey for a lady. If her husband is somebody who can understand what pain she's going through and says, don't worry, even if you don't have a child, let's be a child to each other, that sentence will make her really strong. So I feel despite all the support we give, it is the husband who plays a very important role in the entire journey, and the lady should be made to feel that what is more important is companionship between husband and wife and not just having a child. So I feel the most important thing is to understand the kind of relationship you are dealing with. If you have a couple who has come to you for the treatment of fertility, the first thing I do in Khushi is try to understand what is the kind of relationship the husband and wife are sharing. And if I feel there is a trouble there, I try to address that before starting the fertility treatment. And I
That's
feel
more
that's the most
important, I
important, the crucial crux point in the treatment.
Dr. Sushma, as a psychologist, how does infertility affect?
For example, if I tell right now, ladies and gentlemen, for the next half an hour, don't think about an elephant. Trust me, for the next half an hour, the only thing that you will try your best is you will be thinking about an elephant. The word don't will not be registered in the mind. Only elephant will be registered. So the same thing happens when we tell them, don't worry, don't do this. What happens is the don't is taken away and the worry takes over because they feel that's the most important thing. Like you mentioned sometime back, even unmarried women, girls and men, boys are thinking, okay, do I have an issue? So it's already set in that, okay, there is going to be a problem. So what is supposed to be a normal journey, what is supposed to be a part of the journey becomes an entire journey in itself. And that focus is what leads to a lot of emotional turmoil. For example, marriage and the life of a husband and wife is a huge journey. It's a huge thing where parenthood is also a very important part of it. So when there's so much focus on this, right from the time they get married, what happens is, for example, the natural mode gets hampered. So what is supposed to be a very, a divine process, a very smooth process becomes so stressful and emotionally there's so much of baggage attached that it becomes a goal-oriented process. Every month, yes, every month there is like lot of, they check and it removes the essence from the entire this thing. So that negative emotion is something that we should not be fostering. So that is what happens when they come to the gynecologist also. I think most of the gynecologists also tell them. And then they are also sent to us so that we can also consult them and talk to them and understand what is the mental frame that they are in currently.
Yeah, as soon as they come to us, they'll ask us, Nana, lane problem illa alva. After you explain so many things, they'll say, problem illa alva, doctor, 100% agatte alva. This 100% scares a doctor also. And we should counsel them that everything is just a try. We can't assure 100% that even at IVF, even in IVF where the embryos are beautiful, lining is very good, we can't assure 100% results there. So we should prepare them mentally for positive, negative, both the things, and even the treatment line. Also, we should plan based on their emotions also. We can't directly say an IVF for a person who is totally stressed. We have to give some simple treatments and prepare them mentally. Even though we know they are not the candidates for IUI or simple treatments, but still we should read their mind and plan their treatment.
Yeah, completely agreed. I'm sorry. Because energy matters a lot. See, when you come in thinking that, do I have a problem? The only thing they want to hear is, no, there's no problem with you. It will happen the next month, which is not going to happen. So they need to come with an energy that, okay, let me see what next. So that patience is something that is required at that time, and that's the hardest to have at that moment because you want an instant gratification, which is not going to happen. So very, very important for couples who are into the fertility treatment is to have a mental framework which is strong. I'm not saying full positive where you know things are going to work out. What I'm saying is to have the strength and stamina to know that whatever happens, I'm sure there is a next step to it. It is not the be all and end all of everything.
Dr. Archana, many people like infertility, fertility, actually treatments. How do you address such couple? Repeated failure adaga, how do you address them?
See, my counseling starts even before the treatment starts. So I prepare them mentally when I start the treatment itself. When take it for an IUI or IVF, I'll tell them what is the success rate in each. If it is IUI, I'll say maximum based on initialized success rate, 15 to maximum is 20% in an IUI. So I tell them, for you I can give this much of success rate. And what is the drawback in IUI? It's a semi-natural procedure where we can't see the egg quality. We don't know what is the egg quality. What we see is only the fluid around the egg. So I can't comment 100% your egg quality is very good. Some people think, oh, egg release ಆಯಿತು, ನನ್ನ egg ತುಂಬ ಚೆನ್ನಾಗಿತ್ತು ಡಾಕ್ಟರ್, ಎಲ್ಲ ಚೆನ್ನಾಗಿತ್ತು, ಬಟ್ ಯಾಕೋ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಲಿಲ್ಲ. ಡಾಕ್ಟರ್ ಹೇಳಿದ್ರು ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ, egg ಅಂತೂ ತುಂಬ ಚೆನ್ನಾಗಿದೆ. Then I'll counsel them from there itself. And even when they do an HSG or tubal patency test, we don't know the function of the tube as such. We know that it's blocked or unblocked. We can make out grossly whether it is healthy or unhealthy, but really whether it is functioning well, we don't know. Even the unblocked tubes in given ectopic pregnancy, or they may not even function well. Avaga, our counseling makes an effort there that they should not have too much of hopes for positive results also. and that doesn't mean that they should not have hopes at all. So I'll counsel them in such a way that they'll be able to take negatives also. As you said, repeated negatives is very difficult to treat. There we need Sushma, because that counseling is little on a higher side of counseling, where their emotions are taken care of. And as madam said, husband should be very supportive. First thing is husband, then comes the in-laws. If they repeatedly ask them, oh, hereditary negative, ninde no problem, though it is male or female, we should not point out whose problem it is. Then they can take the results in a positive way, whether it is negative or positive, we have to try. It's only the try from their side and our side. Nobody can give 100% results. That they should be mentally prepared, which we start even before their treatment. Once it is negative, I tell them, okay, it is negative. You want to take a break for a month, you take it. Relax, but don't leave the try. In that month also, naturally you try. In that break, so many people conceive because they don't have the pressure of treatment and to come for a scan or timed intercourse. When you say timed intercourse, it's very difficult for them because emotions are involved there. That becomes a more stressful act rather than the treatment itself. So their patients will relax. So in between, always give a break for them once it is negative. Don't do a back-to-back treatment. And counseling from beginning is very important. That's how we tackle patients. And I always ask husband, this is the place where you have to support, and your in-laws also to support her, because she is taking so many treatments. It's only a sperm which is given to the patient, but pregnancy or the injections or whatever the medicine she is taking already. So she's already under emotions. So you have to support. Family and friends are very much important there.
So basically, family is a support tank. Dr. Rashmi, a long-term on the couple, how do you address them emotionally?
See, long-term procedures in the sense, I think you're talking about segmental IVF, where most of the times
Right.
we do an ovum pickup and we are not able to do the embryo
Correct.
transfer immediately. A lot of people come with the concept that the moment they come for treatment, then within a month IVF will be done and they'll get pregnant the same month. So it takes a lot to make them understand that not every woman who goes to an IVF will have her embryo transfer done in the same month. So we'll have to do ovum pickup, then wait for the endometrial the lining of the uterus to come up properly, and only then we do the embryo transfer. Some of them do have challenges with the lining of the uterus coming up, and they take about 2 months, 3 months, even more, and they'll have to go through procedures.
Sorry to interrupt, but generally, what is the time frame?
Usually, suppose the ovum pickup is done in the month of Jan, then either Feb or March they can go through the transfer if everything goes on well, and if you're planning for a frozen transfer or not a fresh. And depending on the situations, we decide whether we do a fresh or a frozen transfer. And as you said, sometimes the treatment goes on prolonged. Now, the burning issue in today's generation is women who have reduced ovarian reserve. For instance, today morning I did ovum pickup on a lady who had absolutely no follicles in her ovaries. And then after some medications and of course after doing the intra-ovarian platelet-rich plasma therapy, she had a follicle propping up. And today when I did her ovum pickup, the moment she woke up and I told her we retrieved one oocyte, she started almost jumping on the bed and she was so much excited that she's got one oocyte. Just imagine the kind of anticipation with which they come, and they're just waiting for that one oocyte to come out of them. So this reduced ovarian reserve has become a very big thing, and with women not trying for pregnancy early, it's a very difficult thing for us when we see patients. They delay their pregnancy so much. I see some couples married for 6 years, 7 years, and they would have started trying, say, past 6 months, 7 months. When I ask them, why is that you waited for 5 years to start trying for pregnancy, and that too when you're married beyond 30 years? Surprisingly, 50% of them answer, we wanted to be sure that we're going to stay together. And that is something
That is the era we're
valid,
living in.
isn't it? So that is the trend now. They want to be sure that they're going to stay together, only then start trying for pregnancy. And when they start trying for pregnancy, the worst part is some of them actually tell us, we wanted to be well settled in life before we start trying for pregnancy. And you know what is the definition of settled for these couples? Getting a house and buying a vehicle or a four-wheeler is what is called settled.
So that they can take their
and you know,
baby
I
back.
tell them, see, you were waiting for your bank balance to go up. And what happened eventually? Your bank balance went up, but your ovarian reserve and your egg balance came down. So you'll have to strike a balance and decide when to start trying for pregnancy. I think in the yesteryears, the moment you get married, it was that, oh, I'm got married now, the next thing is I should have a child. But that's not the thing now. Women are focused, they want to be financially independent, and they want to be sure that they have the right partner in their life, and only then they want to start trying for pregnancy. With all of these, trying for pregnancy is something that is happening after few years of marriage, and the ovarian reserve is drastically coming down. And there are a lot of autoimmune problems, and post-COVID, a lot of autoimmune problems are propping up, because of which the ovarian reserve is actually coming down, and that's adding to the infertility rates. You know, the incidence of CA breast all over the world is 1 in 9, but the incidence of infertility or subfertility, what we should say, is about 1 in 6. So I think everywhere, in every house, in every family, there will be somebody who is either an inmate of the family or somebody whom they closely know who is dealing with this problem and is not exposed. So I really feel addressing infertility despite the population explosion is a very, very important aspect.
Dr. Sushma, actually grief and loss is quite common in infertility. How do you address such people?
Any emotion, generally when they come out of a gynecologist's office, talking to them at that moment will not help, because the emotions are so high that they will not be in a position to listen or talk. So we have to give them that space to settle down. So generally what happens is they need to be directed to come back after some time to talk, because in most of the cases what happens is the need to talk to someone is so high, but they don't have someone whom they can share. For example, the spouse also might be under a lot of emotional turmoil, so they don't know who to talk to. Sometimes the family will not be capable of handling such situations due to so many challenges even they are facing. Probably they're not able to support in the way that they can. So what we always tell them is, once they go through this phase where there is loss, there is trauma, there is grief, there's always a chance for them to come back and talk to us. We always counsel them. Generally what happens is a clinical assessment can be done, but it will show up a high amount of depression and grief. So what happens is we enter into therapy where we talk to them, counsel them, and the most important thing that is most underrated nowadays is communication with comprehension. They need someone they can talk to who is there to listen with no judgment, not giving them solution or advice. They just want someone to talk to and tell them that it's okay, it's fine, let's go to the next step. Not that yes, it's going to happen or it's not going to happen. Just that I'm here for you, I'm here to listen. Download all your negatives to us so that you go back empty, so that you can fill it in with something positive. And in many cases what happens is we come from a culture where there's a lot of family involvement. So it is not just the husband and wife's journey. I have had cases where the in-laws have come for separate counseling because they are not able to take it. They don't know what to do. So the emotion is always cascaded to somebody else. So I'm not happy, I'll give it to you. You're not happy, you give it to somebody else. The pattern keeps rotating until someone is able to hold it and say, you know what, we'll just keep it down. That's where we come into picture. So talk therapy and various kind of therapies are given so that couples find that space to download their emotions, and also the family. In many cases, there are family therapies involved where we connect to everybody in the family and we talk to all of them so that there is a balance and emotional settlement that happens over there. Because all of us come with different baggages and each family is not the same. Whatever the wife is going through, husband is going through, it differs from case to case. So we have to give them the time and patience.
Patients, they think as soon as you reveal what is the cause for infertility, you should be very careful. It's a sensitive thing. See, whether you say it is oligospermia or something to do with the sperm quality, then maybe the female start blaming husband because of you have to go through so much. So even if it is a small issue with a female, we should always point out that also, though you not highlight it, but you should always say both the problems. Whatever the small issue with the other partner also should be highlighted. And once it is revealed, you should say that they start thinking, why me? Nanige yaak bantu doctor, nam family yargu illa, nanige enak aagtide idu. Then you should tell them it's not that you have to think about. You should just think what to do next. That is where is the solution. It's not that thinking, ayo nanige hinga agoytu, nanige enak aitu, nanige ilva problem yargu ilde irodu nanige banta. Avrige agoytu 30 years ಗೆ pregnancy aitu nam 40 ಆದ್ರೂ ಆಗ್ತಿಲ್ಲ. Avrige 42 ಗೆ aitu ನನಗೆ 40 ಆದ್ರೂ ಆಗ್ತಿಲ್ಲ. These comparisons should not be there. We should always tell them each individual is different. Counseling is too much. I spend almost 30-35 minutes, ma'am knows. We spend so much on counseling rather than on treatment. Treatment is hardly for 5 minutes, but what we talk to them is very important to take the results. As we know, results are not 100%.
Yeah, that's why I think emotionally they should be very well prepared before the treatments actually. And how do you actually address people who are like, for instance, like how do you address stress first thing? when the couple come to you? If they're really stressful, how does it actually hinder your process in fertility treatments?
Of course, stress has a lot of effect on a fertility treatment. It may, as we say, adrenals and the hormones, the stress hormones have a negative effect on implantation also. That's why we always say don't ever think about the results. And I usually tell them don't quit your job. When they quit their job, their only stress is pregnancy and its results. When they are into job or some other things, if they engage into, their stress is divided. It's not concentrated on one thing, so that they'll not think about too much about the results. So that stress about the results, especially after an IVF, 2 days prior to their blood test, there's so much stress that they can't sleep also. That effect is on the negative side. Even if it is going to implant, it may not allow it to implant because of those hormones. Sushma always says happy hormones. That should be inculcated by counseling, and we should tell them always engage into some music or anything that which diverts their attention towards. And even the couple should be, even husband should be counseling her each and every day that it's okay, whatever the results is, we'll see what to do next. That's how the stress should be managed about the results, when I say.
Dr. Rashmi, as you rightly pointed, fertility, the people want to be well settled before they actually go into fertility treatments. Despite that, it is still expensive. Fertility treatments are expensive, as we know. And that is also adds to the stress already. You know, like all the financial stresses adds up more. How do you address such couple?
Yeah, we see that not everybody conceives in the first IVF cycle, and people will have to go through repeated cycles sometimes. That is something which is very difficult on their pockets, especially you see people who are in that age range where they are between the age of 25 to 35 or 40, and that is the time during which they are actually building up their career, trying to pile up some money. Despite having in-laws and parents, they really don't want to be financially dependent on them. So it gets very difficult for them. However, we in the field of fertility have different ways to help them out. Nowadays, insurance also covers for fertility. I think we should push more our insurance companies to try and realize that infertility is not an inborn problem, and it is something which is lifestyle related. When you can cover for surgeries, when you can cover for things that come up in life later, why not for fertility and infertility? Right. They should be covering. I think that is something that will bring down the financial burden and the emotional aspect of the financial burden to a very great extent. At the same time, what we also see is that apart from the financial aspect, there are a lot of other aspects women actually face. They start feeling, I've spoken to women who have told me that sometimes, doctor, when I'm unable to conceive, despite repeated embryo transfers, when I look at myself in the mirror, despite being the most beautiful woman in my surroundings and also in my family, I feel I'm not a woman anymore because I'm not able to conceive and give birth to a child. When we hear such statements from women, it really hurts us. And I've also heard some women who have opened up and told me, doctor, when the entire world can conceive with pleasure, why should I conceive with pain? These are certain statements which actually make us feel that they are the people who have to be taken care of. And we as fertility specialists, though the psychologists play a very important role, and sometimes with our kind of work, we may not be able to give them that time. When we hear people are in real distress, taking them close to the psychologist is the most crucial task we have to do. So I think it's between the embryologist, fertility specialist, the husband and the psychologist that a lady's circle for this journey is completed. And I think the right panel of people are here.
Yes. Dr. Sushma, actually it is more like parental pressure, societal pressure that the couple undergo. How do you advise such people?
Actually, I would like to add to what Dr. Rashmi made a very important point, because what happens is we take it very personally. See, we all have certain characteristics for a man and a woman. For a man, it's the number of children he sires. For a woman also, her womanly femininity is basically in the number of children she has. So we all keep allocated time also nowadays. They say, okay, after I'm settled, I'll do this. When that doesn't happen, it's a very big question mark in their entire identity. So they feel there's a loss of identity. And when there's a question mark on identity, the self-esteem, the confidence, self-worth, everything comes crashing down. And the entire soul and whole focus is only on getting that child. Now it's more than the child, it's more like a this thing for oneself, where I know I want to prove that yes, I am worthy of it. So when that sets in, that becomes the entire goal, whole everything. And some of them come with a lot of trauma in life. They would have gone through a very difficult childhood and they feel, okay, now it's time for me to enjoy life. And when this also doesn't happen, they take it very personally. I have done something wrong. God is punishing me, or okay, I'm not worthy of it. So there's so many things that is connecting. So psychologically, what we do is we go through their entire lifespan to see where they have come now and exactly why, what are they feeling now. That takes quite some time for us. It doesn't happen in one session. So the gynecologists play a very huge role because they pick up these red flags. The way the mother or the father, the wife or the husband is taking this news, the minute they feel something is not right, then they let us know so that they come and talk to us. In many cases, even if everything seems fine, just to have a check if everything is going on okay or not also, sometimes the reference comes. And when once we start, we come from the childhood thinking what happened through the marriage, everything, and then we look at them as an individual, the husband individually, the wife individually, and then them as a couple, and then we take them through the journey. And no matter what is said and done, the unit in this journey is the husband and wife. That is the first circle. The second circle is all the other family members, and the last is the society. So that's how the counseling goes.
But I think society becomes more important these days.
A lot. When they become the first circle, that's where all the problems start. See, we always wonder, what will people think? People will get to know we are struggling. People will feel that we are not doing good. There's so many things associated with what people will think. I don't know who those 4 people are, but we're always worried about the 4 people who are going to talk about us. So somewhere the husband and wife have to know that it is only them both.
That's
And
what
then-
I always tell them. Don't answer anybody. If they
Yes.
ask you, just say, yes, I'm under treatment or we are
It's
trying.
going
That's
on.
enough. Don't
Yes.
discuss anything in detail.
Exactly.
They start discussing, the depth is more.
Depth is more, and you never know what's happening behind you. What is the
Correct.
conversation? What's happening? So keep it.
Society mindset has to change because once they're married, everybody asks them when is the good news
Yes,
coming
They
in.
stop going to marriages and functions. They
Exactly.
think everybody
Right.
will ask, will not. I say, you go, you attend, you have to mingle with people, but don't answer too much of questions. You just say, yes, we are trying. We'll see when it happens. That's how we should answer. We should not
Yeah.
take everything to our head.
And
And
it's
that
just not
answer-
talking to each other when they meet in social occasions. Now, you see any social media, you see Facebook, Instagram, everything is announced. Your wedding, the pregnancy test getting positive, the first scan, the first heartbeat scan, everything is shared. And just imagine when your close friend gets pregnant, they would have done everything at the same time. And when you see your close friend getting pregnant and when she's still trying, that adds to the trauma. I think this peer pressure has come in. The
Social media pressure has to be added up to
peer
the
pressure
list
to
now.
get pregnant. I think there are a lot of social issues because of the social media also.
True, doctor.
And just to add, if you want to answer someone also, first you need to be grounded. If you need to answer somebody and give them that, okay, you know what, everything's going fine, you need to believe in it. And that's where, you know, that mental strength becomes so important, where you know that, you know what, right now I'm okay, we'll look at the next step, we'll see what happens next. Let's not think too much beyond and, you know, and then answer them. So that grounding becomes very important.
Dr. Archana, for couple who are actually exhausted completely with these treatments and all, what are the strategies you offer emotionally and physically to them?
I usually counsel myself first and I connect them to a patient who is positive so that they'll know what is their journey. That positive may not be immediate. They might have struggled for 2 years of negatives and then so many things, so many treatment strategies have been implemented on them, and then last will be positive result. So there are a couple who have tried for 3 years, 3 cycles. I have seen a couple who is a dentist. She did her IVF for 9 times. I stopped her. I told her enough now. 5th cycle is enough. But she went to somebody else. Now 9th cycle she has conceived. That means imagine her mental stability. So basically they should prepare themselves and our counseling definitely, and when they speak to other couple who is negative, who is positive, they should be connected to both of them so that they'll know how to take a negative also, and the positive is not very easy. They'll know both so that they'll not stop there. They may try, and even if they want to stop, they'll be determined to stop there. So that counseling is very important, and connecting to people is the strategy what I use usually.
Dr. Rashmi, how do you help the couple navigate through the ups and downs of fertility?
See, when it is up and down, dealing with up is very easy because it is all about celebration and then you all feel happy that there's pregnancy. The downside of IVF treatment is what happens to them after it is negative. the day they are waiting for the beta HCG report is probably the most difficult day in any lady's life. The moment she gets the beta HCG report, and if it is negative, there is such a gloom in her life that she cannot even explain in words. And what happens to her at that point is the most important thing. The counselors have to play a very important role by talking to them one day prior to the beta HCG report and prep her up to face both the ups and downs. At the same time, I would suggest her to be very positive in her approach, and how much ever we tell, it could be positive or negative, but there's so much of anticipation that builds up with the treatment. Even when they try naturally, there is anticipation. Then just imagine when they go through an IVF, the kind of anticipation that is there in their minds. A beta HCG negative, the downside of IVF, difficult day in a lady's life, and it has to be dealt with very, very sensitively. And the husband has to be there with her when she gets the report is something that I specify every lady, that the day the beta HCG report comes, ensure that she's not alone and there's somebody next to her to hold her hands and say, it's okay. That makes a lot of difference. And what I also see is that when women are going through repeated IVF cycles and it is failure, and then ultimately when we have to talk to them something like, if you have to suggest something like a donor egg or a surrogacy, that's the most sensitive part for a lady, to be able to accept somebody else's egg and then have a child. So these are things that are the downside of IVF, and having an IVF child is not abnormal, is something that has to be posed to the entire society. There's nothing wrong in telling the world that I have had a child with an IVF. There's nothing wrong. And now the generation has changed so much. People don't mind wearing Western dresses. People don't mind going to a place where they can have both vegetarian, non-vegetarian food, a place where they can wine and dine. When everything is accepted, why not have a child through an IVF when it is possible? So I think hiding the fact that the child is born through an IVF is something that has to go out of people's mind, and people have to understand that an IVF child is not different from a child who is born naturally, and that is something which I feel all fertility specialists should come out and tell, and also make people realize that they should understand where they stand when they get married, to understand if they can really postpone their pregnancy. That's why we've been propagating, please check your fertility score, check your AMH, and then decide whether it is conception or contraception.
I think it's better said, IVF, they think it is something, a big thing they have done. It's like cancer treatment. Though it's not like that. For some couple, we have to give IVF as a first line of treatment, and that will give more success for them if we do it at an earlier stage instead of trying a smaller ones which will not help them much. So they should be prepared mentally, and they're so hesitant to say they are going through an IVF. That's why they don't even walk into an IVF center. They go to a general gynecologist. They think IVF they won't do. They won't try an IVF. It's not like that. They should be educated that sometimes that is a first line of treatment for you.
I think when they register the wedding, they should have a fertility test. That should become mandatory. Yes. It's a better possibility. Dr. Sushma, when is it the right time to seek help for a psychologist?
Generally, usually we start with marital counseling itself. So before marriage, it's
with the registration psychologist.
Yes, we need to tell them, because sometimes, like ma'am said, it takes a long time. They want to settle down and also get your priorities set. Okay, so sometimes that marital counseling helps, and after that, when they come to
sorry to interrupt, I think we should make a psychological counseling as a package with pre-wedding shoot.
Yes,
wedding package.
Helps,
yeah.
because
we spend so much for pre-wedding shoot. I think a psychological counseling should be added,
I think a
as a compliment.
Consultation makes a, yes, completely agree. And also when they come to the gynecologist visit for the first time, probably if there are any issues, anything like that, it makes a lot of difference if they can come talk to us. And at least let them know that we are available to help them. We are there to listen to them and they can reach out. And the one thing about the counseling is it's going to be confidential. So they can rest assured that trust can be built in this, and they don't have to worry about things going out. So that is one thing that can be, so it has to be part of the entire treatment.
In brief, Dr. Archana, what is your advice to people who are watching this?
Don't get scared whatever it is. Walk to your doctor. Initially, get the knowledge from Google, but Google is not everything. You have to speak to your doctor, open up whatever is the emotional problem with you, and couples should come together whenever there is a treatment. That's how we can support each other.
Dr. Rashmi, your piece of advice?
My piece of advice would be, yes, as I told you earlier, check your fertility score, understand where you stand in your fertility score. Check your AMH and then decide. Don't ever think of discontinuing the first pregnancy. My advice to every married couple would be welcome the first pregnancy and think whether you can actually take contraception before you actually start doing it. And first trimester abortion for an unwanted pregnancy, when it is the first one, is something that I would say a total no, and would always advise them to welcome the first pregnancy. Apart from that, another very important piece of advice to every couple who is going through the entire fertility journey is three important things. One is confidence in yourself. Second is trust in the doctor who is treating you. And third, and the most, faith in God. I think these three things are the most important factors that will let any lady fight through anything that she is going through in life.
Yes, Doctor, right. Dr. Sushma, your last piece of advice.
Only one thing, it's not a lonely journey. It needn't be a lonely journey. There are people to help, there are people to hold your hand, there are people to just sit with you if you don't want to talk also. It is just that you need to find the right people. So please don't travel in this journey all alone. Please reach out to people who are there to help you so that at least the path becomes a bit bearable.
So I think it's when we've accepted all lifestyle diseases, fertility is also a lifestyle disease and all of us have to accept it. I think people should accept it that way. Thank you so much for being on the panel.
Thank you so much. Thank you.
ನ್ಯೂಸ್ ಫಸ್ಟ್ ನಿರ್ಭೀತಿಯಿಂದ ನಿಮ್ಮ ಪರವಾಗಿ.